Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. This program focuses on different healthcare providers, services, and programs that Kingman Regional offers to our community. I hope you'll stay tuned because after these messages, I've got a great guest on the program today. We'll be right back. Welcome back to Your Health Matters. My guest today is Barbara Boyd. She's the director of KRMC's OB Perinatal Unit. Thanks for being on the show today, Barb.
You're welcome. Great to be here.
So you've been at Kingman for how long now?
Almost 2 years.
Wow.
I came in January of 2011, so it'll be 2 years in 13.
Very good. And what did you do before that?
I was the perinatal director at Willamette Valley Medical Center in McMinnville, Oregon, which is right outside Portland, Oregon.
Okay.
And we were a 110-bed for-profit hospital.
Okay.
And I just was getting cold there in my age, so I decided I wanted to go somewhere warm and sunny and still be in a small hospital where there was good community rapport and everything, and lots of sunshine.
Found that at KRMC?
Yeah.
Good, that's great. So you shared with me before the program, I didn't realize your husband's a career Army dude, right? And he's so he's in Afghanistan. How many tours has he done?
I can't keep track.
Lots, huh?
But a lot, yeah.
Wow, so that's awesome, and thank him for what he does for our community. I'm a ex-Navy wife myself. I mean, I'm still married to the sailor, but he's retired now after 21 years. So I can certainly support what you're doing. It's a whole family involvement to make that happen. It is. So, and you shared he's home on leave, so that's a good thing. You know, a little time with some L&L, and so I really appreciate you being on the show. If he's here at home right now, you should be home with him.
Somebody's got to work.
That's true. Someone's got to hold down the fort. And those babies, they just keep coming, huh?
They keep coming. We've been busy. Yeah, we've been busy.
So, what is the average number of births at KRMC per year?
We're close to 70 a month right now. Of course, before the economy crashed, you know, everywhere in the U.S. there were a lot more births, but we're still inching forward.
They're still populating Kingman.
Yes, we still have lots of babies.
Well, and we're doing some cool things up in our OB perinatal unit.
We are doing some awesome things. We started a rooming in program shortly after I got here where mothers are actually encouraged to have their babies room in with them, to learn feeding cues, to actually learn how to take care of their babies, diaper changes, how to recognize that newborn rash. A lot different than in the past when babies traditionally were, you know, taken to the nursery right after birth and transitioned and not really allowed that bonding time. So, and we were also started within the last year having this skin-to-skin contact. We've all done a bunch of research on it. We had a group in our unit, and we had a little task force, and we started what's called skin-to-skin, which is known to, once the baby's born, if you put that naked baby right on mom's chest, it stabilizes their blood sugar, lowers their respiration. It's kind of like a calming effect to hear that mother's heartbeat.
I've seen it, I guess, in movies or you know, and stuff like that, and I didn't realize that wasn't automatically done. I guess so. That's
it's kind of something new. We started with our vaginal births, and now we're doing it with our C-sections in recovery.
Very good.
And families love it because they get to have that baby right there with them, and it's great bonding time. There's still the option to bring your baby to the nursery if, you know, you're exhausted and you need a break, or, you know, you want to take a shower or anything. We still have that option, but most moms are electing to keep that baby with them.
I would think so. That kind of helps you have not quite such a harsh reality check when you get home, too. You've got someone there to kind of help you in those first few critical hours of readjusting to.
And you still got your nurse right there by your side, so you're not abandoned or anything.
No, that's great. So now, how many rooms do we have in the OB perinatal?
We have 5 labor and delivery rooms, a C-section suite, 2 triage rooms, and then 12 postpartum rooms.
Oh, wow. So now What's a triage room? What is that? What
That's if
happens?
women think they're in labor and they're coming in to be checked out. They can't get into the clinic that day, so they come see us. Or it's 2 a.m. and their water broke and they're pretty sure they're in labor.
But they're
show
maybe
up.
not doing active labor
We
yet.
kind of do an assessment and figure out what's
Okay.
going on, call their physician and let him know what's going
Give
on.
them a
And
heads up,
yeah.
by the way.
Then he makes a decision. Are they staying? Are we going to watch them for a while? Or is it
Okay.
safe for them to go
So
home?
almost like an observation room.
Yeah,
then, is really
exactly.
kind of what it is.
Yeah.
Okay. And then they have the active labor and delivery. You said you have 5 of those?
Right,
So
uh-huh.
you could have 5 babies all working at
We
one
could,
time?
and we've had more than that all at one time. And we just
Really?
kind of juggle. Yeah.
Wow. It's like, wait, hold that thought.
Yeah, because either everybody comes in at once
Of
or, you know,
course.
it's feast or famine in OB.
Well, now, is it true, and I don't know if this is a old wives' tale, if it's really true, that a lot of times when there's like either a storm or something big's coming, it seems like more women go into labors sooner, or have you heard that?
What we've seen is with barometric pressure changes, we see a lot of preterm labor come in,
Oh,
or a lot of
interesting.
women that are due go into labor.
Uh-huh. Like they get kind of concerned about whether I'm going to make it to the hospital if that storm
Yeah.
comes. So
Yeah, well, I don't know. There's something to do with that barometric pressure change.
Interesting.
When it drops, then we get a lot more women in.
Interesting.
So
That's
who
funny.
knows why?
Yeah.
Maybe someday I'll research that.
I was going to say, that sounds like a future study for you, Barb.
Yeah,
For when you're
someday.
board and sitting around home waiting for your hubby, right?
Yeah, I'll sit
That's
there and
what it is.
research that, yeah.
Okay. So I'll keep you on the show next time. We'll talk about that. See what you found out.
See what's going on.
Well, and I know you're doing some remodeling up on the floor.
We
as
do.
well.
We actually got some funds from the foundation, and we the physicians have been wanting an exam room, not per se for our mothers' babies, for our OBs, but for other women in the hospital. So let's say you're on a 3rd floor and you're getting your knee replaced and you might have a GYN problem that the doctor wants to check out. We now have a brand new exam room,
Oh, very
which
good.
is very nice.
Okay.
It's very nice. It's all fully equipped. It was just an extra large storage room that we did a remodel on, and
Excellent.
it helps our patients because then, they don't have to be drugged to the ER or
Oh, and that's what was happening in the past.
yeah, and the
Oh,
doctor doesn't have to try to finagle in a regular surgical bed to try to do an exam. He can
Sure.
just
actually
You can
have
go on a
this.
stretcher, come to our department, get your exam if you need it, and go
Oh,
back to
very
your
good.
room. Yeah, so
Very
it's really
good.
nice. Yeah,
Okay, and I'm sure the doctors like that too.
yeah,
Makes it easier for them.
it makes it easier for everybody. Yeah,
That's good. It's always about win-win for everyone involved.
yeah,
so
makes our
that's
patients
awesome.
happier, and the docs love it. So
Good.
So that just opened.
But then you also have a baby cafe. What's that
Yes,
about?
I brought
Tell
a
me.
little paper to kind of announce it.
Okay. So you're talking about a grand opening in November. So that's, when we're
Yes.
on right now, it'll be coming up. So can they call you to find out more information?
They can, and we'll also have a press release. What we did is we had another large storage room, and we did a little mini remodel. We just got our furniture last week, so we'll do some nice artwork and stock our lending library. And our plan is that's going to be our lactation room.
Okay, so that's the baby cafe. I was wondering,
Uh-huh.
all of a sudden it clicked. It's like, oh yeah, because that's where the baby's
Yeah.
going to eat.
So all of our new moms, starting in November, will be at discharge scheduled for a 4 and a 10-day follow-up if they're breastfeeding,
Okay.
to come back and talk to a lactation counselor. Women who are bottle feeding can also come back. There's no charge for any of this service.
Oh, wonderful.
If they're bottle feeding, they can come back and get a baby weight check. Maybe they're concerned about baby's umbilical cord, it doesn't look right, or maybe they think their baby's jaundiced. Anything like that that has to do with normal newborn, they can come back.
Excellent.
So we'll have our lactation counselors staff our baby cafe. There'll be classes offered. Eventually we'd like to have a new moms group meet there.
Oh, that's a good idea.
Yeah,
like a
we'll-
little support group
Uh-huh.
kind of thing.
And we'll be doing discharge instructions in there. It's just a nice, big, comfy, cozy room. If you work at the hospital and you just had a baby, it's a great place for privacy.
Oh, to be able to
and you
come
can
up
come and
nurse.
pump. Yeah.
Nice. Very good.
So we're really excited about
That's
it. And
good,
it's free
yeah.
community service. We want our moms to come back. So,
Excellent.
and if you don't have an appointment, you can just call our perinatal unit and come back and schedule a time to come in.
Okay, now that's on your flyer there, 757-0651.
Right.
That's the number they're going to call if they have
That's the number they're going to
questions,
call.
Or if they'd like to come in, schedule an appointment, or just come in for a tour. That's cool.
That
can
is,
see
yeah.
it.
Yeah,
And
we're
it's
really-
free. That's another great
Yeah, we're
great
really
thing.
excited about it. And in the past, we didn't have any lactation counselors at all.
Oh.
Um,
And that's kind of a scare, especially for first-time moms. Kind of can be a
Yeah.
lot of pressure. And I think, we all know that nursing, of course, if you can do it, is best thing for mom and baby. So
And all
having,
of us, yeah, and all of us get training in nursing school, but it's just not quite enough. And we do ongoing education. So we had one of our first nurses get her international board certification in lactation. And then we had 4 more get their lactation counselor certificate. So we have 5 lactation staff that are also RNs that work in labor and delivery and with newborns and postpartums. And then we're sending 2 more to get certified in the spring.
excellent, very good.
Yeah, so it's very exciting.
They have lots of staff to answer questions and just kind of be
to make
there.
it work. If you really want to breastfeed, we are there 100% to help you and back you up.
Awesome, that's great. So again, that number is 757-0651 that they can call if they have any questions. Okay.
Right.
Other things going on in OB?
Yes, we have, I'll show you our little Safe Sitter
Oh,
booklet.
this is fun.
Safe Sitter is a nonprofit organization that started up in 1980. A physician founded it from a tragedy with her own child. And where I came from, we did Safe Sitter classes. So the last couple months, we've been working on training staff. So we've got 3 staff members all trained and ready to go. Our first class will be November 3rd.
Okay.
We're going to try to shoot for the first Saturday of every month. And it's for kids 11 and up, so they have to be 11 years old by the time they take their class.
Well, that's
And-
about, I don't think that someone younger than that should probably be
Probably
babysitting
not.
anyway, right?
Probably
They're probably
not.
needing a babysitter themselves. No.
Yeah, probably not. Yeah.
Well, this is a fun book. So this is the workbook
That's
that
the
they
workbook
use?
they get, and then
Okay.
there's certified instructors that'll be teaching. One of them in every class is actually an RN.
Very good. Even talks about how to change a diaper.
Yes, and how
Wow.
to start your own business and how to make sure you're safe when you go into a home.
That's
And the
good.
children are safe. It's free of charge, so it's a great opportunity. If you have a child or a grandchild that wants to do this, it's a great way to spend your Saturday. It's 9 to 4 the first Saturday of every month.
It's just a one-time thing,
It's a
too,
one-
right?
it's a
So they
one-time
get
thing right
certified.
now.
Okay. Now, so do you keep a list of who takes your class? Would you be able to do that? So then if someone wants a safe sitter, could they call you to find out who's?
We typically
Don't do
don't
that?
give out personal
Yeah.
information of kids, but what kids could do at school is go to their counselor and say, I'm certified, because a lot of times parents go to the school, the middle school or the high school looking for
I thought
child
about
care.
that.
Yeah.
Okay, that's a
but
good
they could
place.
always talk to their counselor at school
Okay.
and give out their name, but we typically don't.
Okay, well, I was just curious how they would, but like you said, you're giving them tips on how to start their own business, so probably talking about how they get their name out there and
Yes,
appropriate.
exactly.
That's cool. And that is, I would think both for the parents who are looking for a sitter as well as for the young people that are sitting, that's a great program to offer because it's a big, scary thing, especially first time you leave your child with
Yeah,
a
it is.
stranger. That's
It
kind.
is.
It's you're going to feel better knowing they've been through this class.
They've been through a course. We don't teach or certify in first aid, but we do teach Heimlich.
Okay.
And, basic first aid, when to call 911, when to call the parents, when to put a Band-Aid on a scrape, that
Oh,
type of thing.
Very good. So just
So.
kind of figuring out when is,
Yeah.
and that's
That's a
big
big
part
deal.
of it. Okay.
Yeah.
We're going to take a quick break right now, and then we'll come back, maybe talk about that a little bit more and other things going on up there in OB.
That sounds
Okay?
great.
So
Okay.
stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Barbara Boyd, Director of OB Perinatal here at Kingman Regional. Thanks again for being on the
You
show.
are welcome. This is exciting.
It is, and we've got so much stuff going on up there.
We have a lot going on. We do. We were just talking about our babysitting courses.
Yes.
And I just want to remind people, if they do want to sign up their child or their grandchild, We do need a parental consent form signed,
Okay.
but you can do that by calling just call the main operator of the hospital and ask for the education department.
Oh, the education department is who's working.
Yes, and
gets
we'll
the
have
forms.
something on our hospital website very soon.
Okay, very good, very
so
good.
people can sign up that way.
And can they also call that 757-0651?
They can always call us and we'll
Okay.
direct them in the right direction.
Great,
Yeah.
very good, okay.
Yeah.
So that Safe Sitter class, that's the first Saturday of
First
each
Saturday of the
month?
month,
From
uh-huh.
9 to 4, it's an all-day class, but then they
day.
get their little certificate and their patch. I saw there's a cool patch they get too that
Yeah,
shows
if
they're
they want to
certified.
do something with that, sew it on their shirt.
Yeah, and they get to keep the handbook, so they'll have
Yeah,
that when they go on the job if they have questions and concerns, so that's good too. So, other things that are going on, you offer amazing, actually, number of classes for
We do.
both when they're pregnant and for afterwards.
Right,
so,
and all our classes are free, which is awesome because,
Yeah.
you know, this day and age, everybody wants to charge for something.
Right.
So, because we are so community focused, we do offer childbirth classes.
Okay.
And that's the second Saturday of every month.
Okay.
And those are like a 9 to 5 course. We serve lunch. We go over everything, labor, delivery,
so they kind of get
recovery.
a little tour of the floor.
That's in another.
Oh, that's a
another
different-
time.
Oh,
yeah.
okay.
But they're sitting in a classroom with an instructor and labor, delivery, recovery, what to expect, when
those
to
are-
come to the hospital, when to stay home and wait, when to call your physician, that type of thing.
Okay, very good. And those are all important things, especially for first-time moms. 'Cause
Yes.
there's lots of things going to happen that you have no clue until
Right, and
it's
we
there.
have new things happening in OB all the time. So even if it's your second or third baby, it's nice to come if you have the time. Bring your partner, come on a
Great.
Saturday, kick back, see what you can learn.
Sure.
Because
And
there's
you said
always
lunch provided. That's a good deal
Yeah.
too. Free lunch.
there's always new things happening in OB.
Okay, very
And then
good.
this year we added a newborn class,
Okay.
which is on Thursdays. And what you'll want to do is call education department to get the exact date.
Okay.
Typically it's the third Thursday.
Okay. So they can call the main number 757-2101 and just ask for education.
Yes,
they'll
and that
connect them.
person will, Pam, she'll get them all
Okay.
signed up.
Great.
Yeah.
So what are they going to learn in the newborn class?
They are going to learn how to take care of their baby's umbilical cord,
Okay.
how to change a diaper, how to change baby girls' diapers, baby boys' diapers,
there's
because they're all
differences,
different.
yeah.
How to check your baby for jaundice and when to call the
Okay.
pediatrician, when to just sit on it, that type of thing.
Okay, very
What's
good.
normal in a newborn and what's abnormal, how to take a baby's temperature. All those basic things. When you're a brand new mom, you come to the hospital and sometimes you're so overwhelmed with information
Right.
you don't remember. So this is
Yeah.
more of a calm, laid back environment. You don't have your baby yet. So
I was
you're
going to
just
say, that you recommend, obviously, they take that class before the baby
yes.
comes.
You
not
can take it after, but it's nice
Yeah.
to take it before so you kind of know what's
Yeah, prepared
what's
a little
happening.
bit better and maybe make sure you've got all the right stuff you're going to need, like
Exactly.
the thermometer and things.
Yeah.
So that's all good.
And then right before the newborn class at 6:30, we have a sibling tour, which is also free. So if you have other children, no matter what their age, it's kind of nice to bring them up and they can kind of see where mom's going to stay and where baby's going to stay. It kind of eliminates that fear for them,
That's good too.
especially in a hospital, because if
Sure.
you're 2 or 3 years old, hospitals are scary.
Yeah, scary. Not a good thing.
Scary, yeah. And they think
Okay.
they see their mom in a hospital bed, and they think, oh, mommy's sick, she's not coming
Right,
home. So
yeah.
just kind of reassures them.
Oh, that's good. So then is that when you get the tour of the
That
floor
is
for the moms
yes.
too? Okay.
Yes,
dads.
everybody gets a tour, yeah.
Okay.
And you can always call if you don't have time to go to those and just schedule a tour.
Okay.
If you're at your doctor's appointment, on
wanna
Tuesday
come by.
morning and you want to swing by, just give us a call and we'll make sure we have somebody available to kind
I
of show you
think that's
around.
kind of good to at least get a lay of the land, if you would, so you kind of
Yes.
know what to expect. And,
Yes.
And like you said, once you're in labor, a lot of things just go poof.
Yeah, you're so focused on other things that are going on,
Right.
it's really hard to comprehend anything else.
Yeah, so it's good to have all that ahead of time and bring the significant other along as well, so they can remember.
Exactly, exactly.
That's a good thing.
Exactly.
So you work real close, obviously, with our OB/GYN docs, because they're kind of an
Yep.
important part of the team.
They're our
huh?
heroes.
I know every once in a while I'll see one of them running across over to the hospital. I'm like, oh, must be coming soon.
Yep, they're great guys. Great group.
That's awesome.
Yeah.
And I was thinking there was another class we were talking about earlier,
there is a baby shower
baby
class,
shower, that's nice.
and that's
Okay.
actually put on by the OBGYN.
Okay.
So if you're seeing Dr. Tedesco, Lemansky, Taylor, Jackson, any of those, when you go in for one of your first appointments, you can ask about the baby shower, or you can just call our education department once again and get signed up.
So what is the baby shower class? What is that?
It's facilitated by one of our RNs,
Okay.
and it's at the clinic, so it's just kind of a fun, get to know everybody, get to know what to expect over the next 7, 8, 9 months, what's
So
going
you
to be happening.
early, like the first trimester
Yes.
kind of.
Yes.
Okay.
We want to catch women early so we can kind of clue you in on what to expect, when childbirth classes are, when our newborn care classes are, what things are available.
Excellent.
Because there's a lot available now.
That's really good. And again, as we talked about, your body goes through so many changes. And, you know, it's sad but true that we have an awful lot of young moms here. And a lot of times they don't get to the doctor right away. And I can't reinforce enough the importance.
Yes, prenatal care is very, very important. And to start taking your folic acid even before you think you're going to get pregnant. So you know,
when you're just thinking you're going to start a family, you should start taking
Right.
folic
If someday
acid.
you think you're going to have a baby, let's say you're 18 and you think when I'm 25 or whatever, you want to have a baby, start taking your folic acid now. Just get a good multivitamin with that folic acid in it.
Now, what does that do? I've always
And that
wondered.
prevents neutral tube defects like spina bifida. And those are babies where part or all of the spinal cord is actually outside where it shouldn't be.
Yeah.
So
do we get a lot of that? I mean, do you see a lot of that?
it's not very common, but when it does happen, it can be devastating. Your child could be paralyzed. Obviously, your child's going to need surgery. It's a big, big deal that's preventable. So if you take your folic acid.
Just taking folic acid will help
folic
prevent
acid.
that. Wow. I'm going to make sure I tell everybody I know.
Yes.
Take your folic acid.
It's really important.
I didn't realize that. That's amazing.
Yeah. So if you're planning on a baby next year, I just start taking it.
Okay.
Yeah.
Well, that's good to know.
Because there's lots of things we can prevent. We just have to ask questions and think about it. And you can always call us. Sometimes we have the answer, sometimes we don't, but we will find an answer. Or
That's great.
Or we'll get a hold of your OB doc and find out from him.
Super. Well, and I think that's important for women to know that you guys are so accessible for them, you know, to answer questions. And again, we've given that number out a few times today, but I want to make sure again it's 757-0651.
Yes.
Or they can call the main number, the 757-2101, and ask for education, because they're going to have all the information about all these different classes. So that's a pretty cool thing. And, you know, as we talked about being pregnant and then having that newborn baby, those are scary things that are happening if you don't have the information. But if you've got the information, it's obviously a wonderful blessing, and it just makes it so much easier.
Yeah, and we're here to help. We definitely are here to help. So I wouldn't want anybody to feel like, oh, it's 2 a.m. We have nurses up that are up at 2 a.m.
They probably need something to keep them awake.
Yeah, so they love those late night phone calls. Yeah.
Okay, well that's good to know. Now, also we talked just a little bit before the program about the flu season, and I know that if flu season gets bad, then we limit visitors, and that includes siblings coming up on the floor, right?
Correct. What our big concern is when RSV season comes up. And little kids like to get infected with that. It commonly appears as a snotty nose, cold type of things. But we're really trying to protect our newborns. So we really, if a child is sick, you know, if you're coming to have your baby and you've got a 2 or 3 year old at home and he's sick, there could be a time in February, March, April when we have to restrict visitors. Now, last year we were really lucky. We didn't have to go through any of that. But the year prior, it hit us very, very hard. So your best bet at home, you know, if your kids don't go to daycare, when you're at home with them, make sure they wash their hands, use their hand sanitizer. They don't touch their face and then touch a toy and put it in their mouth, that type of thing. Or and keep them away from other ill
Okay.
kids.
And the important thing, like we said, it's to protect that new baby, as well as
Yes.
even if we've got flu going on, you know, keep them safe. Barb, thanks so much for being
You're
on the show
welcome.
today. Time always goes so fast. I appreciate you sharing all this. I hope you'll join us again next week. We'll have another great guest on the program then.